you have strong people skills and a desire to help others? Can you solve problems on your own and as part of a team? Do you have a knack for working with complex computerized equipment? And can you see yourself learning routine medical procedures? If all this applies to you, a career as a pulmonary function technician might be a breath of fresh air. Pulmonary function technicians use specialized equipment to run tests on patients' lung functions. These tests help physicians diagnose and treat lung disease and other respiratory disorders. To learn more about this career, we got some inspiration from a pulmonary function technician working in Alberta.
Hi, my name is Robert and I'm a pulmonary function technician. Pulmonary function technicians conduct tests to help physicians diagnose and treat various lung diseases.
And then I'm just going to get you to have a seat inside the booth here.
Pulmonary function means how your lungs are performing. So when you're testing someone's pulmonary function, you're kind of testing all their various flows, how much volumes they can get out of their lungs. It's kind of getting, instead of just a picture of the lungs, it's giving how the lungs actually operate inside your body.
So what we're looking at is there any obstruction for you to get air out?
If you're a pulmonary function technician, you can work in a private business or in the hospital in the public sector as well.
So we're going to send this all to our respirologist who's going to do a full interpretation.
Some of the duties and responsibilities are collecting patient information and keeping that in a confidential manner, explaining the test and why you're doing it, performing the actual test with the client, and then also, some patients need other referrals after the testing depending on their result. Other tasks are, just keeping the supply and the inventory up to date, just making sure you have all the equipment that you need, sometimes answering phones and booking appointments, and as well as preparing medications for patients.
We're going to put the puffer in there, and then now it's ready to use.
To really enjoy this job, I think you need to be a people person because you're interacting with a lot of different individuals, be it patients, colleagues, or physicians asking you to do the testing. I think you also need to enjoy, following a set of procedures that are outlined for you. It's important that all tests are done the exact same way. Being organized is also very important because you want to ensure that the right test is being done on the right patient. The work environment tends to be pretty dynamic, so you get all different age ranges of patients, and there's a pretty busy schedule to keep up with every day. So you got to kind of be on your toes all the time and make sure you're flexible because sometimes, patients have different requests.
And this is what we're going to do the test out of here. Okay.
Some of the tools that I use for this role is the body box. So that's where the patient would actually sit during the testing, and then the computer stores all the information, all the previous tests, just kind of for backup knowledge. As far as other things, we use gases for some of the different testings, as well as various inhalers for the test, and as well as education components.
So all that medication just kind of adheres to the back.
So some of the challenges that I see on a day-to-day basis is this is an active test that the patient has to do. So it's not like a chest x-ray where you just stand there and you get a photo taken of yourself.
Big breath in.
The patient has to perform these maneuvers, to a certain level of quality in order for us to give these reports back to the physicians. So you got to really engage that client or that patient and just ensure that they understand what they're doing, why they're doing it, and the importance of them putting all their energy into it.
Big breath in. Good job, come off there.
If you're a pulmonary function technician, you have to complete a pulmonary function technician course, as well as be skilled and certified in cardiopulmonary resuscitation or CPR. I decided to come and work in the private sector here as a pulmonary function technician just because, I like the schedule, I like the interaction with the patients, also like the impact that I could have with the education components of it as well. I would say that this is a great role and profession to get into now. The opportunities just seem to be endless. There's lab opportunities for you in both business and the public sector and the hospitals. You can be an entrepreneur and do it kind of out of your own place. So if you've got an imagination, it's a great career to go into. In my off time, it allows me a great schedule for traveling. Also, I have a hockey schedule that I like to play. So it just provides a lot of opportunities, after hours to really enjoy your life and not have to be concentrated on work all the time. What really inspires me is just the impact that you can have on patients' lives. Be it a 6-year-old or a 100-year-old, you have all those different patients every day, and just spending the time with education with them, doing the testing appropriate with them, and just having them in a relaxed environment while we're doing it. It really just brings out the best in everyone and just helps them with their day-to-day activities.
So normal breathing.
Some patients come in, they have no understanding of their disease, why they're taking their puffers, not even taking their puffers. And sometimes you just actually have to show them what their lung function's like, show them the improvement with their medication, and that just makes the world of difference for them. They come back, 3 to 6 months later, and they're just a completely different person.
Now you can blow it out. Good, perfect, just like that.
Pulmonary function technicians work closely with patients, physicians, and other technicians. That's why good people skills are a definite asset, as well as the technical skills. Learn more about this occupation, including educational and certification requirements in the occupational profile on the ALICE website. And check out related occupations like audiometric technician and occupational health nurse. Explore the possibilities. Go to alice.alberta.ca.